The amount of commitment that these Stony Brook nurses have had to their patients has been incredible. I think everybody has stepped up in their practice here.
I've been a nurse for more, I hate to say this, but more than 40 years, and lived through many things. I've lived through HIV. I've lived through plane crashes and, having to respond to those kind of things through 911, 9/11, but never in my wildest imagination could I even have imagined the impact of something like this pandemic.
We're creating ICU beds in places that there weren't ICU beds before. Working as a nurse specialist, I'm in charge of a large amount of ICU patients. And I don't think I've ever heard a complaint. It's always been like, okay, what's next? Where do we go next? Because I think that everybody just understands that we're all in this together. And that has been a huge theme in this hospital, is that we're in this together, whether you're the housekeeper or the physical therapist or the respiratory therapist. We have really just been together in ways that I have never seen before.
There's an art and science to nursing, and the art, supports that science, so that when a nurse goes in a room, the touch of a nurse's hand on a patient can calm that patient, as well as some medication sometimes. The sound of her voice can soothe someone. That's particularly important right now because the families are not there. So we become people's families. That fear, we have to support them through that fear, and we become that connection for them.
It's part of nursing that is the best part of nursing, in my opinion, because you get to connect with people. And when you make a difference in somebody's life like that, for that small amount of time that you get, it's something that they never forget.
This is a new era as far as understanding what nurses do. One of our nurse practitioners, actually, April Plank, came up with this idea after working a day and realizing that her patients couldn't see her. She took a big picture of herself and she put it on the outside of her PPE so the patient can see. And she said, "This is what I look like." And from there developed the Space Behind the Mask program, where we have people's pictures, their full face, with a statement saying, "This is my name and I'm here for you." The other thing that we put into place, because the families can't be here, is something that we're calling My Story. We have nurses calling family members and asking them to tell us about your loved one. So these are the patients that are on the ventilator and can't speak for themselves. So they tell us the story, and they send us pictures, and then we have a poster that we have in front of the patient's rooms that tells us about that, this was a teacher, not just this is just somebody with COVID on a ventilator, but this was a teacher who has 3 grandchildren, that loves to golf, and Frank Sinatra is their favorite singer, and someone might go in there and sing a Frank Sinatra song to them.
When these patients wake up from being, asleep or intubated or anything like that, it provides us the opportunity to really transition them back into being able to have conversations and talk about their life and things like that. We're really there for them, and we care about them, not just getting them better. We care about them as human beings. We had a patient, it was his birthday, and his family just wanted to be able to sing him happy birthday. And unfortunately, he was incapable of participating, but we brought in a cake. We sang happy birthday for him. He could not appreciate it, but we were able to send those videos to his family, send a picture to his family, and they were able to FaceTime with us while we sang him happy birthday. So it is kind of like becoming a little extra added piece of the family, just to help bring that to them.
As much as we know that how much the community appreciates us, they have been so overwhelmingly supportive and generous. From the food donations to standing out at the streets with signs that say, "Thank you, healthcare workers, you are our heroes," to the chalk drawings that we walk into every day that say, "You are our hero, here comes our hero, we're in this together, we're Stony Brook strong." And as a staff here, we feel them, and we hope that they feel us too, because we do this day in and day out. The pandemic has just made us rise to the occasion, but this is who we've been and what we do on a daily basis as nurses and as healthcare workers here in the hospital. So everywhere you go, the gratitude just makes us be able to do this job just so much better. and makes it easier for us coming in and knowing that we're making a difference to the community.